Hey everyone, this presentation is on reducing your risk of diabetes, chronic diseases, and cancer, written by me, Alex Serafini. Now, some of the things I wanted to go over in the presentation today were the definition of a chronic disease, the different types of chronic diseases that there are, some symptoms and causes for each, some prevention for each, and then just the general conclusions about each one. Now, what is a chronic disease? Well, the textbook defines a chronic disease as an illness or condition that is known to develop slowly in someone and persist over time. More often than not, this is done without obvious symptoms. These diseases often cause pain or discomfort to the victims. However, they do allow the person to live somewhat normally without hospitalization, although there are extreme circumstances in which that is not the case. Chronic diseases are the leading cause of death and disability in the US, with heart disease and cancer being the prime candidates. And some more examples include, but are not limited to, chronic lung disease, osteoporosis, diabetes, arthritis, cancer, and again, out of these five, we're going to circle back first to diabetes. Now, what is diabetes? Diabetes is a very common chronic condition where the body cannot properly process the insulin it needs to sustain daily living. There is two types, with type 1 being the autoimmune version, in which the body's own cells attack itself. And this is usually diagnosed in youth, and this one requires insulin for life. Now we go to type 2, which type 2 is the version that is very much often linked to lifestyle, and it is also the more common of the two types. It happens when the body becomes resistant to insulin or doesn't produce enough insulin to sustain that daily cycle of life that we talked about. Symptoms of this include increased thirst, frequent urination, fatigue, blurry vision, and other symptoms. Now we move on to reducing the risk of diabetes. And there's a lot of things you can do other than just eating healthy. And when I mean eating healthy, I mean specifically you want to make sure that you get a balanced diet with fiber, whole grains, and low added sugars. And it was also recently found in a study that orange and yellow fruits are particularly protective against anyone at risk for genetic diabetes. So fruits like oranges, mangoes, bananas are great choices. You want to maintain a healthy weight through regular physical activity, and in fact, just exercising semi-regularly decreases your risk of developing type 2 diabetes by 60%. Other things you can do are avoid smoking, because smoking increases the blood sugar levels, and avoid excessive alcohol consumption, because that inflates the pancreas over time, and it messes with insulin regulation. Another thing that you can do is just kind of a precautionary measure is just get regular checkups with your doctor in order for prevention. And if you think you're already at risk or know that you're already at risk, it's recommended to monitor your blood sugar levels and consult with a trusted doctor on next steps. Now we move on to lung disease. Now, this is a very broad disease. There are many different chronic lung diseases out there, which are known as CLD. Some of these include COPD, asthma, and emphysema. Some causes of these disease are smoking, air pollutants, general occupational exposures, and some symptoms of these diseases are, coughing, wheezing, shortness of breath. The best thing you can do to prevent these types of diseases are to avoid tobacco smoke if possible, avoid secondhand smoke if at all possible, and wearing protective gear in risky environments, such as if you know you're going to be breathing in anything that you know is not healthy for you. Now we will transition to arthritis and osteoporosis. So arthritis is a condition categorized by the inflammation of the joints in the human body that eventually leads to pain and stiffness. The most common types of this are osteoarthritis and rheumatoid arthritis, with osteoarthritis resulting from wear and tear over time. For my athletes out there, you will most likely be familiar with this if your doctors and or physical therapists have ever talked to you about this in the future. Now, rheumatoid arthritis is the other type, and it is an autoimmune disease where the immune system attacks joints, causing inflammation that leads to bone-on-bone grinding. Regular movement, anti-inflammatory diets, and medication can help manage these symptoms. And transitioning from that, we go to osteoporosis. Osteoporosis is a chronic degenerative disease in which a person's bones become weak and brittle over time that causes some people to look hunched over in appearance. While it can also increase the risk of injury and breaking bones, I would like to mention that it is most commonly found in older adults. The biggest risk factor, obviously, with osteoporosis is age, but it can also come about via menopause and things like poor calcium and vitamin D intake and just general inactivity, sedentary lifestyle, stuff like that. Now, obviously, piggybacking off of what I just said, the prevention for this is just to make sure you're staying as active as you can and making sure you're getting plenty of vitamin D and calcium. However, I would also like to mention that some people are simply more susceptible to this specific disease due to things that are just outside of their control. Like certain people are born with smaller, thinner bones. Some people are bigger and smaller than others, and anyone over the age of 50 is just more at risk for this. Now we transition to cancer, which is the final thing we'll be talking about today. So what is cancer? Well, it can be a lot of different things, but in simple terms, it is the uncontrolled division of abnormal, harmful cells in the body. It functions by invading nearby tissues and spreading through blood and lymph systems. Over 100 different types exist, but the most common types include, but are not limited to, breast cancer, prostate cancer, lung cancer, colon cancer, and skin cancer, respectively. Early detection through screenings increases treatment success, but even then, it's not a guarantee depending on the strain and how aggressive it is. Now we will talk about what causes cancer. Well, genetics can play a role in some types of cancer in terms of what caused it, because cancer is the mutation of these cells. So again, they can somewhat be acquired via passed down through lineage, and some other types can be due to environmental factors. For example, UV rays that we'll talk about momentarily, skin cancer and whatnot. However, lifestyle and these external factors, as opposed to the genetics, are the main causes of many different types of cancer. Not using tobacco products, for example, is shown to be the #1 preventable cause of cancer. And like I said, there are other risks, of course. Alcohol, radiation, poor diet, obesity, and certain viruses as well can also cause it. Now we will move on to reducing your risk of cancer. Generally, like as a whole, the best things you can do are to avoid tobacco in all forms, including secondhand smoke, kind of like I mentioned earlier. Eating a healthy diet with fruits, vegetables, and limited red processed meats. I also found in the textbook that it says scientific evidence suggests that 30 to 40% of cancer deaths are related to overweight, obesity, poor nutritional habits, and lack of exercise, which is found on page 393. Exercising regularly and maintaining a healthy weight go hand in hand, both for health and reducing your risk of cancer. And if you can, reduce any kind of exposure to harmful radiation in order to better prevent cancer from forming. So prolonged use of tanning beds, general UV rays, not applying your sunblock, etc. To wrap up, I just want to go over the common prevention themes that are present throughout each of these diseases, which being that balanced nutrition and portion control prevents and can help prevent many of them. Consistent physical activity is always a good thing, as long as you don't overdo it. Avoidance of harmful habits like smoking and heavy drinking, and also just mental health, your stress management, and good sleep do wonders for your health in many different ways. And with that, we get to our conclusion. I just want a few points I wanted to touch on. If you don't take anything else away from this PowerPoint, make sure you take this away. Most chronic diseases can be delayed or prevented through lifestyle choices that you make. Early detection, regular checkups drastically improve outcomes for all of this, especially cancer. And I recommend that you empower yourself with your own health knowledge to take daily action so that future you doesn't suffer from choices that you make today. That's all. Have a good day.